you think about it, meds are stupid. Your body is very intelligent. Meds go in and they're like, I'm just going to hammer this one thing, because if you're a hammer, everything's a nail, right?
Right.
And meds can only hammer nails. But what I'm trying to get at is, how do we heal everything?
Let's ditch the quick fix and dive into today's conversation.
Welcome, everybody. My guest today is Dr. Lindsey Elmore. Dr. Lindsey is a board-certified pharmacist and a functional medicine practitioner. She believes that all people deserve to be healthy, happy, and fit. She started the Lindsey Elmore Show to cast a vision for the world as a better place, one where every woman can pursue dreams, overcome obstacles, and leave a meaningful legacy. Dr. Lindsey is also the owner of Lindsey Elmore LLC, a multifaceted health store. Welcome, Dr. Lindsey.
Hey, thank you so much for having me. Excited to be here.
So I'm very excited to have you here. That was a very brief intro to a more complicated background that has brought you through pharmacy to a big focus on natural health. So maybe you could kind of fill in some of the information that I got started with the brief intro there.
Sure. So when I was a child, I wanted to grow up and be an actress and a singer and a dancer. And my mom was like, no, you're going to get a real job. And I had a natural acumen for science. And so I got a degree in chemistry, and I was planning on going to medical school. And I just started studying for the MCAT and was just like, I don't know that I want to take this test. I don't know if this is the right path for me. And then I decided to get a PhD in chemistry, and all of my colleagues that I worked with at the lab that I was working at the time were like, you're not PhD in chemistry. That's not you. You're not going to like this job. You're not going to like this career path. And I was like, well, crap, now I have no life plan. And my colleague came in one day and was like, I know exactly what you should do. Become a pharmacist. And I was like, sure, I'll become a pharmacist. And so I ended up applying. I was so tired of living in Alabama that I only applied to 2 schools of pharmacy, both of them in California. Only one of them interviewed me, and I ended up being accepted to the #1 school of pharmacy in the country, and really excelled, loved the knowledge that I was learning, loved all the things. But during my first year of pharmacy school, I tore my ACL. And when I tore my ACL, they put your leg in a brace and it locks your knee in place to where you can't really bend your knee. And so every step you take, in order to accommodate your leg that can't bend, you're hiking your hip and hiking your hip
Right.
and hiking your hip. And I realized one day I was studying and I was like, I can't sit on my sit bones anymore. And so I go to the chiropractor for the first time, and my right hip was like a solid 2 inches higher than my left hip, just jacked, just pelvis was jacked. And I mentioned to her, hey, doc, I haven't slept in a month and I feel like I'm going to die. Like, I am exhausted. And she said, well, if you're exhausted and you need help, you need to go to the acupuncturist. And that was where the light bulbs started to flicker on, because I started to realize there is an entirely different system of medicine out there that I had never heard of. And so, because I was living in California and had amazing insurance, I was able to go to the chiropractor, go to the acupuncturist for free every single month under my insurance, and really started to ask a lot of questions about, what is Chinese medicine? What is 5-point acupuncture? What is all of this stuff? And I thought about going to get a degree in traditional Chinese medicine, but because I was so driven by accomplishments, I ended up, and I'm like, nope, first year residency, nope, second year residency, nope, academic position. And ended up having a breaking point one day, after I was gone for my academic position. I was working as a transitions of care pharmacist. So the Center for Medicare and Medicaid Services, they only pay for hospitalizations if the patient doesn't bounce back within 60 to 90 days, depending on the disease state, depending on what happened to them. And so I was counseling all these patients who had heart attacks, strokes, acute decompensated heart failure, diabetic ketoacidosis, all of these things that if the patient bounces back, Medicare is not going to pay for their hospitalization. And I had this moment where I'm bebopping into this guy's room and I've got his 5 medications because he'd had a heart attack. And so heart attack, you win the lottery. You get an aspirin, you get a statin, you get a beta blocker, you probably get an ACE inhibitor. And I can't even remember what his 5th medication was. But I go in and I ask him, how many meds were you on before you came into the hospital? And he said, none. And here I am handing him 5 medications that he's basically expected to be on for life. And probably one of them was a proton pump inhibitor. Like, no. And
do you have occasional brain fog or forgetfulness? Studies have shown that our brain has the best health at the age of 22 and deteriorates each year after that. Iso-alpha is a natural brain health supplement with over 40 scientific studies to verify it stimulates the vagus nerve and improves brain function. It uses bioavailable hops bitter concentrate to allow the nervous system to get into a flow state to release chemicals that help with hand-eye coordination, memory, and quick thinking. Iso-alpha guarantees results in 90 days or your money back. You can get this brain health formula at isoalpha.com. That is isoalpha.com. Go to isoalpha.com now to get your proven brain health formula.
I just said, I can't do this. I cannot do this. And so ended up just really putting it out there into the universe. Like, I got to get out. 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 I've got to get out. And ended up getting hired by a health and wellness company, worked for them for the better part of 5 years, and then was given the opportunity to become a contractor. And so that's what I did. And I've been solely self-employed for going on 8 years now, and just teaching people that, like, you deserve to be healthy and your health does not depend on your physician.
That is so good. So good. And I want to get into the specialty that you really have, and that's into the microbiome and gut health and things of that nature. And so I'm going to read this recent Instagram post that you had, because I think it really kind of leads us into, the craziness that has been causing such a problem with our gut health. Yeah. So, and this is just one of them that you put, and there's many points here that you make, but I'm just going to get a little bit here. There are days when I think back on my days in practice, all the medications, all the surgeries, all the vaccinations, all the screenings, and the time I personally came very close to accidentally killing someone with meds. And I just can't believe that we have come to this point at a collective. In America, we have truly been conditioned to believe that seeing commercials for the most harmful foods right before a commercial about a medication for diabetes is normal. And basically what you said there that speaks to the heart of this podcast is we're taking this commercial, which is a commercial for bad food, and it's a quick fix for food or trying to eat, followed by a quick fix for a medicine to try to rectify what you've done to yourself by eating that fast food or that unhealthy food. And it really leads to, in a very summarial way, why the gut is not healthy in the majority of people in America and across the globe. So why don't we jump into that?
We have normalized sickness, and we've normalized sickness to the extent where we think disease is inevitable. Like, that's crap. That's not true. It's just simply not true.
Agreed.
I truly and firmly believe that if we can get our minds and our guts healthy, everything heals. Everything heals. Even the worst of things. Some things are harder to heal than others. but when you heal one thing, you heal it all.
Mhm,
I
mhm.
think we've lost sight of how interconnected our body. We've lost sight of the fact that the lungs are not disparate from the pancreas. They are not disparate from the brain or the skin. It's all one thing, and it's all one thing that works very closely together. And so, yeah, I think back, I often, I mean, you never forget a patient that you almost killed, ever.
Mm, mm.
It never leaves you, and you will never make the same mistake again. But I still remember, because it was just a math error. It was a math error. I was never a great student of math. I at one point thought I wanted to be a chemical engineer, but I couldn't handle the calculus. I just like could not do the math. And then
Sure.
when I got into pharmacy school, it became very clear to me, if you don't do the math correctly, someone will die.
Yeah.
Um, and there were two very distinct experiences of math being very important in my career. And the first was when I, so if you're in the ICU long enough and your gut's not working and you can't do feeds via your nasogastric tubes, you have to get IV nutrition through something called a total parenteral nutrition, a TPN. And back in World War I, we started to notice that when GIs were coming back from war and they had been so starved for so many months on end, and they started gorging on food, it was first identified in the literature, something called the refeeding syndrome,
Hmm.
where when you feed people too fast after they have been starving for days, weeks, months, it causes a shift of your potassium from extracellular to intracellular.
Okay.
And that intracellular potassium shift can be deadly. And you want your serum potassium to be around 4. 3 is yikes, let's get a drip going, because you can't bolus, you can't push calcium, it's deadly. That's literally part of how death sentences are carried out, as they sedate the
Okay.
patients on secobarbital and then push potassium. And so you can't push it. And so you can't like rush to fix the patient. So around 3, you're like, okay, let's do 20 millimoles. Let's do 40 millimoles. 2 could be deadly. 1.5 is probably you're dead at that point. My patient's potassium was 2.2 that morning when I woke up. And I instantly was like on the phone with the hospital, like making sure, you're laying in bed, checking your computer, checking your phone, and you see that you almost killed somebody.
Hmm.
And I will never ever forget to divide a TPN by 3 again.
Hmm.
That was all I did. That was all I did. I did all the calculations correct, and I forgot to divide by 3, because you divide by 3 and then you ramp them up over the course of days. And that was a really important lesson. And then another terrifying lesson is, I was staffing the pharmacy one night, night shift pharmacist. I had been a pharmacist for like, I don't know, 3 months. Like, I am so green at this point. And a baby was born opiate addicted, and the fentanyl prescription comes to me. Well, fentanyl, the math is hard with fentanyl, which is why it's ravaging America right now, because I'm not trying to make myself or, criminal drug dealers seem stupid, but when you're dealing with morphine doses, you're dealing with like 5 milligrams, 10 milligrams.
Mhm.
When you're dealing with fentanyl doses, you're dealing with like 125 micrograms, 250 micrograms.
Yeah.
And so it's these really, really small
Yeah.
increments of 3 digits instead of 1 or 2, right?
Right.
And
Right.
sorry, the math with 3 digits is harder than 1 or 2. And this little baby, I was so terrified of the math and so terrified. And we weren't a pediatric hospital. We didn't have a pediatric
Okay.
pharmacist. Like, babies born at our hospital were not well-to-do infants, right? They were very marginalized pieces of society. Um, and I couldn't get another fellow pharmacist to like check me, work with me. You know, I
Mhm.
remember literally the nurses are calling me and they're like screaming. They're like, "You don't understand what this baby is going through." And I'm sitting here going, "You don't understand how hard I'm trying to ensure that I get this dose right, because if I overdose this child, they will die. They
Right.
will die." And I remember literally running through the halls of the hospital with this bag of meds in hand. And you've never heard a scream like a scream from an
Mm.
infant withdrawing from opioids.
Uh,
And I just remember sitting by that kid's bedside and just going like, "Dear God, let me have done it right. Like, let me have done it right." And thank God I did. Thank God I did. And been a couple of very, very close calls, converting somebody from, there's dangerous meds out there. You convert
yeah.
somebody from U100 to U500 insulin, like you're calling them and, you're taping up their insulin syringes, and they get admitted to the hospital. You're personally calling their nurse and going like, "You don't understand how dangerous this med is. If you think you're pulling U100 and you're pulling U500, you're going to kill somebody." And so, yeah, when I was watching Food Network one night and I'm like, "Wait a minute. We're going to get processed, genetically modified food commercials followed up by, here's a medication with an endless litany of side effects that are going to potentially destroy your life and destroy your microbiome." Because, like, you think about it, meds are stupid. Your body is very intelligent. Meds go in and they're like, "I'm just going to hammer this one thing," because if you're a hammer, everything's a nail, right?
Right.
And meds can only hammer nails. But what I'm trying to get at is, how do we heal everything? And so medications are known as xenobiotics. So xeno means foreign and biotic means earthly plant. And so these
Mhm.
are foreign things from the earth. Well, when you take foreign things from the earth, the body is very smart at going, "Oh my gosh, get rid of that foreign entity." So guess what? Your microbiome becomes better at metabolizing all of these things. And so you see people that are on metformin for their diabetes, one of the most commonly prescribed drugs
Right.
in the United States. It literally shifts your microbiome to be a better metabolizer of metformin. And so now you're going from 500 milligrams once a day to 500 milligrams twice a day to 750 in the morning, 500 at night. And then all of a sudden you've got a gram in the morning, a gram in the afternoon, and you've got rip roaring lactic acidosis because of the side effects of the meds. It's just, there's a better way. There's a better way for us to approach health. And it's not by band-aiding the symptoms at the top. We have to work on the underlying conditions. And in functional medicine, there's only 8 root causes of disease. And if it's not one of those 8, it's not anything. If it's not stress, toxins, intoxicants, allergens, antigens, allergens, antigens, and autoimmunity. If it's not an infection, if it's not dysbiosis, falls under there, nutrient excess, nutrient deficits, sleep, sedentarism, and sociogenomics. It's not anything. So whatever is ailing you, one of those 8 things is the root cause of it all.
Right. Right. And so, try to unwrap a little bit of that, the big problem. Well, one of the things I want to say right off the bat, thank you for being in those situations and taking the care that you took to make sure you get it right. And that's, one of the things to share with, when we're having these kinds of conversations, there's a little bit of hey, we're not the biggest fans of pharmaceuticals, but we just understand that a lot of doctors and nurses are doing the best they possibly can with these pharmaceuticals with the right heart, right?
Sure.
The sad thing is there's just an imbalance. There's this huge imbalance. And so basically, like you said, there's these foundational components that really lead to the health of the body. Not the lack of medications. The lack of medications is not, the health problem.
No.
And so if we could make the balance be a little bit better, that would be very, very positive. So you've got some basic essential focus on the biome and healing elements. I mean, you've written a book on essential oils and essentially foods as medicine. So kind of dive into what you're teaching and recommending health strategies towards a healthy microbiome that's getting beat up by food, getting beat up by toxins, getting beat up by medications, EMFs, and everything else.
Yeah, absolutely. It's interesting that you mentioned EMFs because EMFs have become increasingly more prevalent inside hospitals, and they're shifting the pathogenicity of bacteria inside of hospitals. All of the EMFs are actually making bacteria more pathogenic inside of hospitals. It's staggering. We are very rapidly approaching a post-antibiotic culture. Like antibiotics are simply not going to work anymore. So we have to work on our microbiome so we can crowd out the bad stuff and keep the good stuff in, right? Okay, so there is a protocol. It's called the 5R protocol. And this is how we heal and restore our microbiome. And so the first thing is you must remove gut triggers. Like, I hate to break it to you, friend, if you're still eating sugar and gluten and inflammatory dairy and glyphosate poisoned plants, all of the things, your gut is never going to work right for you. So you must remove the gut triggers. And I also would like to add in, your biggest gut trigger is stress.
Sure.
Your biggest gut stress. If you have stress in your life, that's not like that you're not resilient towards. We all have stress, but if you're not resilient towards it, you're not going to get where you want to be. Okay. So we must remove our gut triggers. Then we have to repopulate with probiotics and prebiotics. And I specifically advocate you've got to have strain specific probiotics. You cannot just go willy-nilly and pick up a random lactobacillus. You must look for, like, for example, Lactobacillus rhamnosus R0011 is an example of a very strain specific probiotic that we know what it does is it reduces stress by lowering cortisol exposure and improves our GABA signaling, right? So if you are someone under chronic stress, you might not need a Lactobacillus acidophilus. You might need something much more specific. Then what you want to do is have probiotics and prebiotics that are matched, because I think a lot of us are like, we need prebiotics so that we can feed our probiotics. But if they're not matched and you don't know what they are doing, it's a problem. They got to be matched. So remove the gut triggers, repopulate with probiotics and prebiotics that are strain specific and matched. Okay. Then the next thing that you do to heal your gut is we have to repair the lining of the gut, because if your microbiome is out of whack, then your gut is leaky. And here's the thing. If you have leaky gut, you also have leaky brain, you have leaky skin, you have leaky lungs, you have, leaky genitalia. Like, it all is leaking and allowing inflammatory mediators to get into places where they otherwise should not be. Okay. So to repair the lining of the gut, we specifically must supplement with L-glutamine. L-glutamine is one of the primary food sources for the
Okay.
enterocytes. So entero means gut, cyte means cell. So these are our gut cells, and the glutamine is going to feed those gut cells. We also know L-theanine is very important food. They're few and far between. There aren't that many postbiotic supplements out there, but if you can get your hands on some kind of butyrate supplement,
Okay.
great for the lining of the gut. And then, of course, just the importance of omega-3 fatty acids and vitamin D and magnesium as a core piece of basically every supplement routine under the sun cannot be overstated. So now we're going to repair the lining of the gut. The fourth thing that we have to do is we have to replace what has been lost. So over the years of leaky gut, you've lost all your B vitamins, you've lost all your amino acids, you've lost all of your postbiotics. And so we need to supplement with all of those vitamins and minerals that have been lost over the course of years. And so we add all of that back in, because here's the thing too. We don't teach patients that the medications that they are on are depleting vitamins, minerals, and especially CoQ10. Friends, if you listen to nothing that I have said in this entire interview, if you are on a statin medication, I want you to go immediately to the pharmacy and get a CoQ10 supplement. In Japan, it is required by law that every pharmacist dispense a CoQ10 supplement alongside a statin medication. And in the United States, we have this epidemic of people taking statin medications, which Pfizer completely manipulated the data to get that drug to market through a statistical manipulation called absolute risk reduction versus relative risk reduction. It's a soapbox for me.
Don't get me started.
Don't get me started on the difference between absolute risk reduction and relative risk reduction. It is so gross, so blatant, so manipulative. It's so terrible. And this is how, people are on the news saying random drug X is 95% effective. And the first question out of my mouth is, at doing what compared to what? My last pharmacy student that I mentored, man. Yes, you have these questions, 95% effective. At what compared to what? My last pharmacy student, we got asked about a new drug that had just come to market. I had never heard of this drug. And I was like, well, let's pull the studies and let's see what got it to market.
Sure.
And he ended up at the end of this, he said, this is criminal what they just did, because what they did was they could not. So when drug companies start trying to bring drugs to market, they do initially what is called a superiority. So they need to show that their drug is superior to either placebo or to the most common drug on the market in that product class, whichever they're ballsy enough to compare it to. Most of the time they're going to choose placebo because it's a lot harder to show superiority to an existing drug. Well, this drug company, this asthma drug that they came up with, they couldn't prove superiority. So they go back, redo their clinical trial and compare it to placebo. And instead of doing a superiority analysis, they do what's called a non-inferiority analysis. So can you show that this drug is non-inferior? So it doesn't do more harm than a placebo. And that was what got that drug to market. They were able to show that it didn't cause any more harm than a placebo. And me and my pharmacy student were like throwing crap at our computer screens, because it's like, but you also didn't show that it helped.
Right.
You didn't show that this drug makes any difference.
Right.
And so the statistical manipulations that go into bringing drugs to market are very icky. They're very, very icky. And once you see it, you can't unsee it.
I tell you,
And
I so want to go down that rabbit trail for about 4 hours, but
yes.
let's continue on with
Yeah.
making sure that you
So
have co-cue. And
no, yes. Okay. So the fifth R in our 5R protocol is called rebalance your attitude. And
okay,
so, because if you have a bad attitude and you're just a
yeah,
nasty, cantankerous person who decides that I'm just going to be stressed out by everything, good luck healing your gut.
right,
Good luck.
right,
So that's the 5R protocol that we use to heal our guts. And when the gut heals, all of the gut axes heal as well. And so your gut brain axis, your gut heart, gut lung, gut skin, all of the axes heal.
yeah, and essentially, one of the things, without going down that rabbit hole too far, the simplistic approach that people have got such a confidence and faith in, hey, these have been tested, the FDA, the CDC have all done their job to make sure that they're safe. And that happens right into the doctors and nurses, right? It's not just the patients, but yeah, it's just the system is just really, really not good. So what are some of the common things that you're looking at and coaching on gut health specifically? I know SIBO is one that's very, very common. What are some of the things that you're seeing there, and maybe just a couple of specific supplements that you would recommend for something like some of the common problems with gut health, whether it's Crohn's, celiac
Sure.
disease, SIBO, those kinds of things.
Yeah. So, I mean, I work with people all day to help heal their gut so that their mental wellness can be
Mhm.
better, so that they can have greater resilience to stress, really and truly. Because the more I learn about the body, if it's not a cortisol problem or an insulin problem, those are basically your two core
Huge.
problems, huge problems. And so I really work on cortisol, and I want people to live a life where they're not stressed out. That's the bottom line. And so I work on people's guts all day long. And so if people are coming to me and they're like, my gut is jacked, I think I
Mhm.
have small intestinal bacterial overgrowth, I first work on getting digestive enzymes into them, as well as doing some herbal based, senna, aloe vera, slippery elm bark, burdock root, milk thistle. Because if
Mhm.
somebody's coming in and their gut is really jacked, you got to give it a fighting chance before you start throwing massive amounts of probiotics and prebiotics their way, because otherwise it's just going to cause this proliferation of bad bacteria. And so I also work with people like, listen, if you will commit to doing an elimination diet for I will take what I can get. Can you give me 3 days? Can you give me 7 days? Can you give me 21? Can you give me 30? How many days can you do an elimination diet where we are eliminating all of those pro-inflammatory foods and really focusing on meditation and exercise
Mhm.
and really working on all of the problems at once. I really like to work on all the problems at once. And stress is the biggest one. Toxins in our foods and in our
Mhm.
relationships is a big one. Removing all the allergenic foods out of our diet is a huge one. Sometimes I get to the point sometimes where I'm like, hey, if it's not anything that we can identify, it's time to start looking for chronic stealth infections via stool testing, mold toxicity testing, all the tests that are not great for Lyme, but we can look for all
Right.
the things. And then really working on key nutrients. Because here's the thing, in America, we are chronically calorically overfed, but we are completely devoid of nutrition. We have
Yeah.
no nutrients
No nutrient
in, we
density.
have no nutrient density. And it's because our soil microbiome
Right.
has been destroyed by not only glyphosate, but a minute ago, you were like, people think that the FDA and the CDC it's cute that you think they have your best interest at heart, because neither does the EPA. Like, just
Right.
like, why don't you just allow DuPont Chemicals to pour chemicals into the environment that we will never be rid of,
Right.
ever? We will
Right.
never be rid of them. And so, you know, in interviewing Gerald Posner on my podcast and in interviewing John Abramson in my podcast, you mentioned something really important a minute ago. And you said doctors and nurses are kind of doing their best. Yes, it's the way they've been trained.
Mhm.
But John Abramson, you know, Harvard physician on faculty there, has testified against the pharmaceutical industry dozens and dozens of times. And here's the thing, our research and our peer review research process is broken, because
Totally.
you can submit anything and be like, promise you it's the real data, wink, wink, nudge, nudge. And nobody goes back and checks.
Mhm.
And when John Abramson got his hands on all of these big pharma computers to just like dig into, he's like, they just lie. And I was like, of course they do. Which is why I took a hard left. And so, you know, some of my favorite supplements, I love some supplements from a company called Amare. They've got a pack called Happy Juice that not only has it has a product in there that lowers cortisol, improves GABA signaling, raises dopamine, raises serotonin, all
Okay.
of the things. But it also has some nootropics that help
Okay.
with focus and cognition, and helping you to recover from exercise and have better workouts. And so I love Happy Juice. If anybody wants to save $10, go to lindseyelmore.com/Amare and you can shop there. I also have a dispensary at Full Script where I will give people more generic supplements, things like magnesium biglycinate, huge fan, vitamin D3. Hey, hear this loud and clear too. Always take vitamin D3, not D2. So vitamin D3 I use a lot. I play around with the ratios of EPA
Mhm.
to DHA depending on, am I looking for cardiovascular health or am I looking for mental health, because
Emotional
there's
well-being. Yeah.
different studies. And so I use a lot of those. I love the mold binders from
Okay.
Cellcore, are really great supplements. Cellcore has a lot of amazing supplements that can help with stealth infections. They have great um, parasite cleanse supplements that
Talks,
contain things.
parasites.
Yeah.
Yeah. Good.
Contain things like mimosa pudica seed in there that can be really good. I mean, we deworm our animals, but yet we don't deworm ourselves. It makes no sense. You know,
Right.
every one of us could be doing some quarterly parasite flushes. So those are just three of the companies that I use a lot of their products. And
Okay.
so, yeah,
Nice.
I really like all of those.
Nice. Well, boy, a ton of information. And, I was going to ask you if you're still associated with Amari Global. It sounds
Yeah,
like a very good company.
yeah.
And you said, Cellcore, another one. So, one of the other things I'd like to ask you about too is the Microbiome Summit.
Yeah, absolutely.
So
So the
share about that.
Engineering Your Microbiome Summit is coming up. It is free and online, September 26th until October the 2nd. I did more than
Okay.
40 interviews with industry experts, and we talk about everything, engineering your microbiome for skin health, for anti-aging. We talk about how to engineer your microbiome for a better oral microbiome, for healthier saliva. We talk about how to heal SIBO using probiotic supplements, which seems just ridiculous, but we talk about how to engineer your microbiome to combat cancer. We even have an interview about how to engineer your microbiome to have better orgasms. And so we dive deep
Awesome.
into the microbiome, and it was an amazing summit. Got to interview some very, very intelligent people about cutting edge stuff. You know, we interview somebody about how to engineer your microbiome to avoid EMFs, how to do it using ozone therapy, just really cutting edge stuff. You know, how sweat facilitates a healthier microbiome, just it layers and layers and layers. And so, like I said, it's free and online at the end of September. Go to lindseyelmore.com/microbiome to get signed up for that today.
Cool. Very cool. So why don't you just kind of give us two take-home points from what we've talked about, and then any other way to follow up with you. I think that summit's a really great opportunity for people to just get good information. So
yeah. I guess my two take-home points are: you deserve to be healthy, period. And everything heals. I don't care how far down a rabbit hole that you are of 5, 10, 15 years of sickness, being told by doctors that this is never going to get better. Everything heals. Now, that's not to say that it's not going to take a medication to get you on the other side of it. You know, I was talking to a mom yesterday, and she said, my daughter, her pituitary doesn't work, and her doctor says you're going to be on hydrocortisone for life. And I was like, yep, you'll die without cortisol. You'll die. So everything heals, and there is no right or wrong way to heal. Just keep doing it. And so those would be my two big takeaway points. And you can find me at lindseyelmore.com, at Lindsey Elmore on Facebook and Instagram, at Dr. Lindsey Elmore on Pinterest and TikTok. And I have a subscription functional medicine website called wellnessmadesimple.us, and hope to see everybody at the Engineering Your Microbiome Summit.
that is so awesome. Hey, I'm very excited. Thank you for joining us here today. A ton of information, and there's so much that you have to offer at your website, and this summit sounds like it's going to be great. So, hey, everybody, thank you for joining us today, and I hope everybody has a blessed day.